Yeah, okay. Uh, Welcome to our session. Let's start our another session. This is the completion of our 3L. The first, leverage, second, level up, and now it's lead. This lead session, we mainly wanted farmers and community to be the lead of animal health emergency program. Our idea is to increase resilience of farmers and community to deal with animal health emergencies through good husbandry practices and improve biosecurity. So for this session, let us start with watching the video.
Nag-decision ko nga akong ipadayon ang biosecurity kay para po dili na magkasakit ang akong mga hayop sama sa akong baboy o sa akong mga manok o pabo dili na magkasakit. Dahil ang akong baboy makuha na po siya dili na po magsigig gasto para magdaot sila.
Biosecurity is not only key to combating African swine fever. It is the first line of defense for any animal disease incursion. In the past, farmers allowed animals to freely roam around, exposing them to a wide range of disease risks, including ASF. Through the Community ASF Biosecurity Intervention, or CABI program, we work hand in hand with local farmers, providing them with practical training, developing biosecurity solutions through a co-creation process, and also we supplied some basic materials to improve farm infrastructure. This farm, the farmer went beyond the project scope. She applied same biosecurity principles to her poultry pen. She applied physical barrier for different species, then also hygienic entry-exit protocol, as well the meshing net installation to keep wild animals out.
Sinugdanan, nakagasto jud ko, medyo nakagasto jud ko og dako-dako, pero sa lahutay nga akong gi-implementar ang biosecurity, medyo naka-income jud ko kay kuan man wala naman magdaot ang akong mga baboy hasta ang akong mga manok ug ang pabo. So okay na kayo nga tumanon ra gyud ang biosecurity.
This is how we envision for smallholder pig farmers. Farmers taking ownership and leadership, practicing biosecurity, and most importantly, they encourage neighboring farmers to follow the same practices. Our CABI farmers are now biosecurity champions, and they are strictly following biosecurity measures in their communities. This role model will help build stronger, healthier, more resilient communities and making ASF prevention more sustainable at the grassroots level.
Thank you very much. And now I would like to invite Mr. Domingo Caro III. He's a regional ASF advocacy and communication specialist from FAO ECTADRAP. He will give a presentation on risk communication and community engagement. Over to you.
Thanks very much, Uni. So this afternoon, I'd like to welcome you all again, and I would be talking about a few things. I'll introduce what RCCE is, or Risk Communication and Community Engagement, why it matters, and FAO's approach to RCCE, and including the key strategies and tools that we use, and maybe walk you through what lessons we've learned in the field. So risk communication and community engagement for ASF control. Some people might be wondering what this is about. It is a critical component in managing ASF or any transboundary animal disease control in particular. ASF, as you know, is a highly contagious viral disease, and it poses this threat, not to humans, but the thing is its impact to livelihoods is very much great. That the and then on top of that, the absence of effective vaccine means that prevention and control relies solely on or heavily on biosecurity measures, which means including early detection and public cooperation. So the drivers are mainly on behavior change. So this is one of the things that we've sort of focused on in the campaign. So integrating risk communication, as you've heard in the previous presentation, communication has been part and parcel of all strategies that countries have included in their managing outbreaks. So in our approach, community engagement goes beyond information dissemination. So it's not only public awareness, but it also including the stakeholders to make sure that they are part of the design of any interventions that is presented to them. So basically, what Dr. Josh earlier said, they know how and why. So why does our RCCE matters for ASF? So as I said, it is a challenge, and so basically it's heavily dependent on so many factors. Human behavior plays a pivotal role in disease transmission, as like pig movement, farm visits, and trade, and it can accelerate the spread of the virus. RCCE addresses these human behaviors, these drivers, to foster awareness, correcting misconceptions and misinformation, including disinformation, if you may. It ensures that stakeholders, including farmers, traders, veterinarians, and other related stakeholders, including policymakers, understand the risks and adopt the measures. So basically, they have the information and they would know how to move forward. FAO's RCC initiatives highlight the need for transparent communication to build trust and confidence among communities, which is essential for effective outbreak management. By integrating RCC into ASF management strategies, we help mitigate the socioeconomic consequences of the disease, protecting livelihoods, and maintain food security in affected regions. So what is RCC's approach? We have adopted a One Health collaboration, and it aligns well with the framework because it's multifaceted for a complex disease like ASF. RCC is integrated with the technical measures such as surveillance, emergency response, and biosecurity to enhance outcomes. There is an emphasis on behavior change communication, which is a core element focusing on tailored messaging, participatory process, and feedback. So as you can see earlier, our speakers have emphasized how they were the interventions were co-designed with them, and not not from the top to bottom. Okay. So operational key strategies and tools. We have used CAP surveys in the countries to identify drivers, and there was a mention of the training biosecurity measure. This is a related offshoot of all the activities that we did. And we've also used most popular messaging platforms to make sure that our message cuts across stakeholders. Simulation exercises has also been used, and I think there's also a mention of the Community ASF Biosecurity, and one of our partners will be talking more about that. So lessons learned that we've learned along the way. There are challenges in ASF management experience, but RCCE proved to be a handy tool, and then it became a key element in the strategic role. It made an impact in terms of making sure that we're reaching our stakeholders in a positive way and making sure that they're on board whenever we move forward with any intervention. I think that's about it. I hope you found found that insightful. But if you have questions, please don't hesitate to ask.
Thank you, Jim, giving us how important RCCE is and how we embedded RCCE into our ASF program. So now I would like to invite Dr. Caroline Benigno. She's the president of Field Vet Health Services. She will let us know how did CABI started.
Okay, thank you. Thank you, FAO, for the invitation. Okay, so CABI from concept to application. First, I'd like to acknowledge our partners here, the national government, FAO, ROK, and my NGO. So really the initial problem started with rapid ASF outbreaks devastating smallholder farms. And there's always a blaming smallholder farms of breaching biosecurity. They're always blamed for that. And there's lack of awareness among smallholder farmers. So there's a need for simple community-led practices to be installed. So in 2021, we had discussions with FAO on the framework. While there are already guidelines on biosecurity, the question is, how can we engage communities to really implement biosecurity? So this was in 2021. And all of us were focused on communities because it spreads through movement of pigs, pork people, etc. And then swine raising is a form of investment for communities. And communities are the first line of defense. And so we have to propose something that is low cost and sustainable. And that's why CABI was born. So CABI was a term coined by one of our field staff in the Philippines. It's Community ASF Biosecurity Interventions. It started from observations about farm practices, and researchers and veterinarians partnered with the local farmers and developed, this was very important, to develop low-cost, behavior-focused biosecurity solutions. We wanted it to be very sustainable, that they can maintain such interventions. So the first pilot was in a village in Mindanao, where there has been no record of ASF outbreaks. We chose about 20 farmers. So we did, because it's a pilot, we did so many data gathering work, like their knowledge on ASF, economic data, how pig raising really plays a role in their livelihoods. So we chose these 20. Very critical is that they're willing to participate. So we had that. And the implementation took about 5 months. So from introducing biosecurity to implementing it. And the most important thing is that these 20 would agree on the set of biosecurity measures to be put in place. It cannot be just one, but they all agree that it should be holistic. Okay. So the key principles introduced were restriction of pig movement, control of visitors, especially in a field setting. There's so many people coming in and out of the house. Cleaning and disinfection, safe disposal of food and dead pigs, and really it should be a community-wide shared responsibility. So these are just the pictures, I think, that were shown of before and after in that pilot village. Okay. And that's it. So after that 5 months, so the pilot village remained ASF-free even if nearby villages were hit by ASF. The farmers continued to adopt biosecurity practices. The neighboring communities copied that model because they thought it is working, and now it has expanded to other areas in the Philippines and other selected countries in the region. So what made it work? I think it's really the collaboration with farmers as partners. Okay? The low or no cost intervention, because we used local materials so that they can maintain it. community champions, which the video was showing, and peer learning, and respect for local culture and practices. So the movement grows. Community ASF biosecurity became a scalable approach. I think it's now going to be called Community Animal Biosecurity Intervention. So it was, the adoption was advocated through meetings of local government units, NGOs, and other veterinary networks, and continues to evolve with training, mapping, and monitoring. So if we train the community leaders, then they could probably expand the application of CABI. So that's it, because empowered communities build safer farms. Thank you.
Thank you very much, Caroline, to giving us how the process, how CABI was born. And also, I'm very thankful to being our beloved partner rolling out the CABI. This is also the small token of appreciation from FAO. Thank you very much. Now, time has come to hear more voices from the field. To start our panel discussion, I would like to invite our panelists to the front seat. Ms. Isidra Cerealis from Vice City, and also Chris Joy Pangol from North Cotabato, and Dr. Melanie Pescadia from Vice City, and also Joshua Cruz from the Philippines. And also I would like to invite Hercules Thomas from West Kalimantan, and Mike Arianto from also West Kalimantan, and Donnie from DGLAHS, sorry. Then last, I would like to also invite Suban to come from Lao PDR. All right, thank you very much joining us today. We are really honored to have you all here. Well, first, I would like to ask to our CABI farmer, how did CABI change your life? I may start with Thomas first.
Oke. Adil Kak Talino, Bacuramin Kak Saruga, Basengat Kak Jubata.
Oh yeah, sorry. This is a day greeting. Adil Katalino, Bacuramin Kak Saruga, Basengat Kak Jubata. This is a day greeting, which means fair to people, reflecting heaven, and breathing in God.
Saya Hercules Thomas, peternak babi dari Kabupaten Landak, Kalimantan Barat.
I'm Hercules Thomas, pig farmer from Landak Regency, West Kalimantan Province, Indonesia.
Saya ingin mengucapkan terima kasih kepada FAO, Kementerian Pertanian Korea, Kementerian Pertanian Republik Indonesia, Dinas Provinsi Kalimantan Barat, yang sudah memilih kami menjadi penerima manfaat untuk program CABI.
I want to thank to FAO, Ministry of Agriculture of Korea, and Ministry of Agriculture of Indonesia, who selected us to be beneficiaries for the CABI program.
CABI mulai diterapkan di tempat kami mulai awal tahun 2024.
The CABI program began to be implement at our location starting at 2024.
kami rutin melakukan penerapan biosecurity pada kandang kami, seperti sebelum masuk kandang kami harus mencuci tangan menggunakan sabun, celup kaki, kemudian membersihkan kotoran menggunakan skop dan sebagainya.
We routinely implement biosecurity measures in our pen, such as washing our hand, dipping food before entering the pen, and then using the shovel to lift up the manure, and etc.
Program CABI memberikan banyak manfaat kepada kami. Saat awal sebelum program CABI diterapkan, populasi babi saya berjumlah 6 ekor.
The CABI program provide many benefit to us. In the beginning, before the CABI program was implemented, my pig population was 6 head.
Dan berkembang menjadi 46 ekor dan bahkan saya sudah menjual 31 ekor babi saya.
And it has grown to 46 head, and I have even sold 31 of my pigs.
Yang paling penting adalah sampai saat ini babi saya masih aman dari penyakit ASF.
And the most importantly, my pigs are still safe from the ASF.
Saya berharap program CABI dapat terus berjalan dan disebarkan ke peternak lainnya. Terima kasih.
I hope the CABI program can continue and be disseminated to other farmers. Thank you.
Thank you so much. You became a rich farmer now, and hope you can really expand and enjoy all those things. And now I would like to invite Isidra to also share your story.
Ako si Isidra Serialis, taga Bais, Negros, usa ko ka farmers.
She's Isidra Serialis, a farmer in Bai City.
Nagsugod ko og buhi og baboy year 2008.
She started raising pigs since 2008.
Pagsugod nako usara ka buok ako ang baboy, dayon nahimo ni siyang gapataas nako, nahimo ni siyang duha hangtod nga niabot ang year 2024 nagkasakit amo ang baboy dito sa Bais, niabot ang ASF.
She started with one until we were affected with ASF in 2003, and then 2003.
2008.
2003
Ah, 2000.
Kalimutan niya. Now, 2023. Ilan na ang baboy karon?
Nahimo na ni siyang kuan akong baboy ron, niabot na ni siya og 20 ka buok ako ang baboy.
Okay. So from 1, now 20 na daw. She has 20 pigs.
Ug dako kayo og tabang ang CABI namo sa moang pamilya tungod kay napa-improve nako ang ako ang mga baboy og
CABI help improve our livelihood, and
tungod sa CABI, tungod sa training sa CABI, dako ni siya kayo og tabang nako kay ako ni siyang gi-apply sa ako ang kinabuhi. Ug
because of the training from CABI, I applied it in my life.
tungod sa CABI ang ako ang mga binuhing baboy nalikay jud siya sa sakit. O
Because of CABI, none of my pigs got sick.
ako ang mga baboy maoy nakasurvive.
Only my pigs survived during ASF outbreak.
Ug tungod sa CABI, pagka ospital sa ako ang anak, nakatabang og dako ang ako ang mga binuhing baboy.
When my child got sick, my pigs helped me a lot to pay for the bills. For the information, her son had an accident, so the income from the pigs were used to pay for the hospital bill.
Dako ko og pasalamat sa CABI tungod kay dako kayo ni siyang tabang nako ilabi na gayud sa tibok na kong pamilya.
I thank CABI for it helped me a lot, especially my whole family.
Thank you
Thank
so
you.
much. Thank you so much for sharing your story. I hope both of you would continue implementing biosecurity in your farm. Yeah, you both are rich now. We are very happy for you. Now I would like to invite our local colleagues and also field implementation team. The question is, how did CABI change in the lives of the CABI farmers, and what are the plans in the future for CABI in your locality? I would like to invite Chris Joy first.
Hello, good afternoon. I am Dr. Chris Joy Pangol. The implementation of CABI in Barangay Sagkungan significantly improved the livelihood, practices, and confidence of a farmer to prevent the devastating effect of ASF. Its impact can be described in several major areas. First, it restored livelihood and economic stability, where repopulation became possible due to improved community-level biosecurity, giving farmers the confidence to raise pig with the severe threat of ASF losses. Farmers gained regular sources of income from pig sales, piglets, and related products, enabling households to plan a long-term investment in their farms. Second, it improved biosecurity and practices and farm management. So the farmers learned and adopted daily hygiene such as foot baths, controlled visitor entry, disinfection, and waste management. So before the CABI, many farmers have a minimal biosecurity. After the intervention, they applied a structured, simple, and low-cost measure consistently. So the clean and improved pig pens created a healthier animals, lower mortality, and better growth performance. Third, it has a stronger community cooperation and collective action. CABI uses a bottom-up community-driven approach which strengthened cooperation among farmers, barangay official, and local livestock aides. The Sagkungan residents became more unified in enforcing barangay-level movement control, reporting sick animals, and ensuring compliance. The community ownership of the program ensured sustainability, even after the FAO engagement ended. Fourth, it increased knowledge and capacity, in which through trainings, the farmer field schools, farmers gained skills such as recognizing ASF signs, understanding disease transmission, basic epidemiology, outbreak response, and proper disposal and sanitation. So the farmers felt empowered, saying they now understand why biosecurity matter, not just how to do it. So fifth, it enhanced food security and household stability. As pig production resumed safely, families restored their traditional role in raising pigs, such as for food, ceremonies and cultural events and emergencies. Pigs again serve as a saving asset, helping household manage expenses, medical needs, and daily necessities. Six is strengthen trust in LGU and veterinary services. Farmers in Sagkungan expresses their greater confidence in barangay leadership, municipal agriculture, and veterinary offices because of their active involvement. The rapid response system and the regular monitoring improve relationship between farmers and animal health authorities. Seventh, it gives psychological and social benefits. So CABI restored hope, dignity, motivation as they successfully raised their pigs. community meetings, and shared successes strengthened social cohesion and mutual support. Lastly, model for other barangays. The success of the CABI in Barangay Sagpungan has inspired nearby villages to replicate the same low-cost biosecurity practices. Sagpugan farmers became now a local champion, sharing their experiences in both provincial and municipal activities. As the future of CABI in North Cotabato, first scaling up within the provinces, given the success and the promising result of the pilot study in Barangay Sagpungan, the CABI and similar community biosecurity models will be expanded in the barangays in North Cotabato, especially in higher risk areas. Second, sustaining local biosecurity champion. Farmers who participated in the pilot study may be trained and peer-to-peer trainings to monitor the communities and help maintain practices. Fourth, long-term institutionalization. CABI community-led model may be institutionalized to a local government practices through local veterinary offices, barangay agriculture, or livestock units could take over the maintenance support and monitoring biosecurity intervention. The goal would be the biosecurity habits to persist beyond project phase, making pig raising more resilient to ASF.
Thank you so much. Actually, for your information, as Caroline said, the Sakungan Barangay in North Cotabato was the very first pilot of the CABI. Actually, without the success from North Cotabato, we may not see today Isidra or Thomas being with us today. So thank you so much for your great effort to make this program successful. Now, I would like to move to Mike, shuffling the countries. Share your story.
Yeah. Hello, good afternoon, everyone. My name is Ahmad Mike Arianto. I'm a veterinarian officer in Plantation and Livestock, West Kalimantan Province, Indonesia. Since CABI was implemented in 2 pilot area in Pontianak City and Landa Regency in West Kalimantan Province, it has had a significant positive impact. There has a change in perception and increased farmer understanding in implementing biosecurity to prevent ISF. Currently, in 2 CABI pilot area, there have been no more ISF cases again, and there has been an increase to pig population, even in Pontianak City, reaching 100 to 120% for pig population. To ensure, to ensure CABI program that sustainability in West Kalimantan, in this year we are replicating the CABI program in Singkawang City using our own budget. We do farmer training and was open by the mayor, and Miss Yuni was attend in Singkawang, and we provide biosecurity equipment to farmer such as a sprayer, boot, disinfectant, brushes, and etc. And we train farmer with existing module with topic cover, isolation, cleaning, disinfection, and movement control. And next year, we plan to replicate CABI program again in Sanggau Regency, which border in Malaysia. I believe that biosecurity is key. By implementing biosecurity or CABI program, the pig population in West Kalimantan can be restored again. I hope FAO, Ministry of Agriculture of Korea, Ministry of Agriculture Indonesia still support us. Thank you.
Thank you so much. Well, now, shall we hear from the experience from Lao PDR?
I think they mentioned all. Okay. Thank you very much, Dr. Yuni. Yeah. Again, Suban Sili Thamabong from the ABO Laos office. So it's my try to express the sincere thanks to the ABO lab team support for the farmer in the Sanyabuli. I think the one has been designed at the Sanyabuli province with selected 18 farmers. That is in the way consultation with them. Not only we support everything, is we need their contribution, their in-kind and what they need and how we can support them. In this way, it can sustain. If we all support them, everything, when the project ends, because I work at the project almost 20 years, every project end and then the activity has been ended. But what we are looking for at the CABI in Sayabuli, they will continue. I'm pretty sure they will continue because with that, practice the biosecurity. They know, they see their pig is healthy, they generate more income for their household, for their families. And the activity that's implemented in Sayabuli, that's also highlighted at what we call the party member at the Sayabuli province. That's they use this information and promote at the party as well. I think that's the support from BBO and from the central government. That's it. That's the key. But how to expand is still the challenge because subject to the budget, government project, of course. Yeah, the constant that we face so far. That's what I want to expect to the team here. Thank you very much. Yeah.
Thank
Dr.
you,
Yuni. Yeah.
Suban. And now, Melanie, your story.
Good morning, good afternoon. CABI have changed, we have observed so many changes. From the farm level, I have observed that there has been behavioral changes. They used to throw their garbage, their discharges to the creeks, to the rivers, destroying our environment. But now, because we made it a point, through our local policy, we made it a point that waste management becomes a mandatory intervention. So all smallhold farms will now have septic tanks. So they will not be allowed to raise pigs if they don't have septic tanks. And because we observed that good change, positive change during the implementation of CABI. So this CABI initiative also change the disease prevention and control strategies of the city of Bais, since we have constant monitoring. I have observed that the community monitors, even when we stop the CABI implementation already, they are still still continue monitoring it. And beyond CABI, including the disease monitoring, surveillance, and all. And we are so happy, but because of the output or the positive feedback from CABI, the local government of Bais allocated 3-year funds. We sourced it from the local disaster risk reduction management council, and our planning officer said that if we can maintain and if we can have good results, they will double it. So we are just happy for that. And because of that also, we have now a new improved Bais City Veterinary Code where biosecurity is a mandatory parameter for all facilities, not just for smallhold farm. And I have also observed during and after the implementation of CABI, the communities are now united. And I have also observed that even those who are not part of CABI are copying CABI, and Uni saw it. And more than that, they became teachers, mentors, not just for BAIS residents, but also from other LGUs who are constantly visiting our CABI communities, looking at how they implemented it. And the good thing that I also observe, for farmers like Isidra, before they are not so confident in sharing. They are so shy. But now they became teachers to a lot of visitors. So even if most of them are not able to read and write, but at least their voices are heard, and not just for BAIS and for the rest of the province and some parts of the Philippines. Thank you.
Thank you so much. Well, even though we heard certain CABI expansion through local government's funding and budget, now I would like to extend to our two gentlemen from central, representing central government. Well, what would be the future of the CABI? Can I invite Indonesia first? Tony.
Well, actually, all colleagues here already touched some of the for the future plan. I think for the international level, we think the CABI as one of the tools for the disease control must be became one of the key performance indicator for the government in central, also in the local level. So if they success to control the disease, it means the performance good, something like that. And then replication, yeah, it must be one of our target to replicate to the other provinces. We can target to the province that have a high population peak in several provinces in Indonesia. And I think another thing is bring the example of farmer that succeeds and currently he is rich now. Emphasize him as a mentor, as an example. So we try to encourage them as an example. Also bring maybe a government from the local for other province to visit this their village to see what happened, because they actually they are the real champion, right? So they will hear what the champion do. They keep their pig 24/7 days, every day. So I think bring them to the national level to talk to the high-level position maybe will be good. That's all.
Thank you very much. And what about the Philippines? What's the future? Nationwide expansion?
Okay, thank you. So thank you very much. Sorry. So for the Philippines, so we are the pilot for the CABI, and we want to continue to be the model also for everyone, right? And for the CABI, because serious, in realistically speaking, before the CABI program, the government have interventions before, but it always fail. Why? Because they always think biosecurity is expensive. Smallhold farms cannot adopt biosecurity. It's only for commercial farms. And it lacks supports. But CABI, it changed how we view biosecurity, even at the national level, that biosecurity should adapt what the community needs and what the farmers needs, not what on the paper written at what the scores in the biosecurity, but rather what the farmers needs for them to adapt and implement and biosecurity. And we saw that in the CABI implementation, we have discussion this with our management, and they can see, because the farmers became the model now, that they can see that we can implement biosecurity at the smallhold farms, not only for commercial farms, because they can invest, but for smallhold farms, even simple things that they can now adapt this biosecurity. So it's a change for how the government views, and even for me personally, because before we are focused only on resolving ASF cases, on stopping the disease, but now we change on not only stopping ASF is not the challenge now, but rather how we could support more the farmers during these ASF outbreaks, and even after the ASF outbreak. And this CABI is one we are looking forward to. Now we have hearing stories and questions a lot from the other national government, local governments. They're asking us how we could implement CABI in our areas. So they're now asking, our governor is thinking about project. It's not only about dispersal of pigs, giving pigs to the animals. Now they're asking how we could coexist this giving pigs and giving also by supporting biosecurity for the farmers. So just like last week we had this Animal Health Congress, a lot of LGUs asking us how we could implement this biosecurity. So now it's the national level to take lead and support guidance for them on how they could implement this also to their areas. And for the national government, we allocate fund for the training of these biosecurity champions farmers. And now I'm looking, we can do also TOT for the monitors of the CABI so other LGUs can adapt it. So now it's trickling down on how we could implement biosecurity. And now I'm looking forward, even the Philippines looking forward at how we could expand this biosecurity from pigs also and also to the other animals. So that's all. Thank you very much.
Oh, that's great. Actually, CABI is really showing very genuine example of bottom-up approach. And last week, there was a ACAS launching event and also CVO, ASEAN CVO meeting. And we also presented, and all the CVOs from ASEAN member countries, they noted on the success of the CABI. So we are hoping to have ASEAN CABI policy brief be endorsed in the near future. So thank you very much all again for your hard work, which could lead to another policy making. Since we have like 15 more minutes, if you have any questions, maybe I can open to the floor. No? Okay. Then another our token of appreciation. Small one.
No repeat order. No repeat order.
Okay, thank you very much. Big round of applause to our panelists. Now we are closing this session. For the housekeeping announcement, tomorrow during our coffee breaks in the morning and in the afternoon, we have, can I have your attention please? We will have another mini talk from another pilot areas, one from Ilocos Norte from the Philippines in the morning